always ask me where are the incisions on a deep plane facelift, and every surgeon has one of these videos out there, but they think that I'm going to do something different, but we're not making up anything new over here. So I'm going to show you on our nurse injector Bree where these incisions are, where her markings are, and she obviously does not need a facelift, but let's take a look. So I'm going to have you lean your head back and turn to the side. So unlike traditional smash facelifts that really pull good on the lower jawline but don't get much cheek lift, a lot of those, the incision can stop right here up in the hairline. But with a deep plane lift, we're actually lifting the cheek and the jawline all together. So all this extra skin needs somewhere to go. So the incision actually instead extends up a lot higher. So we go in the sideburn hairs, right at the edge of it, because we don't want to raise the sideburn. If you hide the incision in the scar here and you pull vertically, you're going to cut the sideburn off. So we go right along the sideburn hairs here. Then we follow the natural curves of the front of the ear. And then in some patients, based on their anatomy, we'll actually go in front of this structure called the tragus. And most patients, especially most female patients, would actually hide it on the side of this here so that the incision hides right there. Make a little back cut here. Follow this incision here. Then in the back of the ear, we hide everything up in this crease. And wherever the ear is widest, typically, we try to find that here, and we will either go across up here like that, or we will continue this incision out so that the ear hides this part of the incision. And then the rest goes down into the hairline like this. So similar to the sideburn incisions, we don't want to go across here like old school lifts, because one, you're not able to redrape the skin well here, and then two, you can shift the hairline. For patients who we're doing a deep neck lift on, if you could lift your chin up, we do a small incision right here at the crease, which gives us access to these structures right here. And then if you could turn to the side. So the typical markings we do when we're doing procedures like this is we'll mark out the jawline. The standard deep plane entry point is right here from the angle of the mandible to the lateral orbital rim. So we go down here. We also mark out where the frontal nerve branch is of the facial nerve. And in a lot of patients, what a lot of surgeons are talking about is the new preservation approach, which we try to use as much as we can, where we'll actually enter the deep plane a little further anteriorly, or posteriorly, sorry. So we only have to lift skin to about here, and then we enter the platysma and the deep plane here, about here. So in a lot of patients, we literally only lift skin to about right here, and then everything else is done underneath here. This part of the SMAS flap that's still attached to the skin fits all the way up here like a puzzle piece. So at the end, there's barely any dead space for fluid to build up in. In patients with larger necks where we have to do more neck work, we will actually lift up a little more skin in the neck and connect this all the way across. If we don't have to do a lot of that, we can leave the skin attached down here. When we do a deep plane approach, again, one difference between a traditional facelift and deep plane, with a traditional one, we lift up a lot of skin. All the skin is lifted and the muscle is just pulled back. With the deep plane, we're lifting up less skin, but there are these key retaining ligaments here. Right around here, we have our zygomatic ligament. All of this is fixed to the parotid gland, which we lift off. We have our cervical retaining ligaments here. Sometimes we release the mandibular ligament here. So all these ligaments are released, so everything without tension can gently be brought back up and get us a nice natural result. When we do a vertical rejuvenation, we add in lateral brow lift. That can be done in two ways. We either extend this incision up the hairline like this to lift the brow like that, or we do an endoscopic approach where we make an incision that hides here and sometimes two additional incisions that hide in the hair to bring the lateral brow up, so that when we bring this cheek up, we don't have to extend our incision super high and this can all come up naturally as a unit.